From what I understand of it, I came off the helicopter. They immediately put me on bypass because they're like, oh, this is like an emergency situation. I think they're struggling to find a pulse on me at that point.
Just weeks before graduating college, Nick Counts collapsed. When he woke up, he was in a different city in the hospital recovering from open heart surgery. Turns out he had a rare life-threatening syndrome he never knew he had. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Nicholas Counts was enjoying his final semester in college at KU. He'd been going out with his friends, having fun with his girlfriend, but he wasn't feeling well, and he thought it was simply from burning the candle at both ends. A lot of kids in college feel like that. Instead, it was from a ticking time bomb in his chest.
Hello, hello.
How you doing?
Good to see you. How are you doing?
Good.
Yeah?
The last time Nicholas Counts and cardiothoracic surgeon Dr. Tyler Zorn saw each other, Nicholas was on Dr. Zorn's operating table. And they have a lot of catching up to do.
Did you finish your classes that you had to do, or you had a couple?
Oh yeah, I'm good. I'm good. I'm graduating.
All done? Graduated?
Yeah.
The CT scan we did today looked really good. Do you remember the day?
No, I don't. I don't remember anything. I've honestly been forgetting pieces of
You
it.
don't remember the surgery?
No, yeah. I hope not.
He's here for his 3-month checkup after what was supposed to be a fun-filled final month at KU before graduation took a terrible turn.
My girlfriend found me unconscious in the bedroom of our apartment at the time.
The trouble began a few days before that, when Nicholas began feeling what he describes as a combination of nausea and heartburn.
And then I went to go take my exam, ended up vomiting in the trash can in the room, which is a little nasty to do in front of your classmates.
His girlfriend picked him up after the final and took him home.
The last thing I kind of remember was going down to go take a nap because I wasn't feeling good, and then waking up in the hospital like, I want to say 2 or 3 days later.
Nicholas would learn he had suffered an aortic dissection. In simple terms, the layers of his aorta, where it connected to his heart, were separating, and Nicholas was in grave danger. After being rushed to Lawrence Memorial Hospital, he was then airlifted to the University of Kansas Health System. This is where Dr. Zorn performed emergency surgery, replacing his aorta. As Nicholas recovered, he and his family were in disbelief at how this could have happened to him.
And I went like all my life thinking I was like pretty healthy.
So he got genetic testing, which led to another stunner. Nicholas has Marfan syndrome. Marfan syndrome is a genetic disorder affecting the connective tissue of the body, including the heart. People undiagnosed and untreated are at a higher risk of having an aortic dissection. While most people with it are extremely tall and have very long arms, legs, and fingers, not everyone exhibits those traits. Case in point, Nicholas.
Undiagnosed, I didn't know I had this.
Yeah.
And thankfully I was in a place where I was able to get some of the best medical care I could have possibly gotten.
And now he's ready to get back to the post-college life he had been planning.
I went through it, came out the other side, it's still me. I'm gonna enjoy life.
It's a pretty good goal. Enjoy life.
Yeah.
We are so happy to have Nick Counts joining us this morning alongside his cardiothoracic surgeon, Dr. Tyler Zorn. Thank you for being here. And we also have joining us virtually 2 of the Lawrence doctors who treated Nick when he was first rushed to the hospital. We have Dr. Brandon Ricke, who works in the emergency department at Lawrence Memorial, and cardiologist Dr. Elizabeth Gustello. Thank you both for being here.
Thank you. Thanks for having us.
Nick, first off, how are you feeling today?
Pretty good, yeah.
How long has it been since that surgery, the big event?
A year and a couple of days now.
Okay, you're looking good.
Thank you.
And you came in after working an overnight shift because you're now a nurse.
Nursing assistant.
Nursing assistant, which is fantastic. Did this experience shape your decision to go into medicine?
I mean, I wouldn't say necessarily. I mean, my aunt's always worked in like healthcare, and she's a nurse, and I mean, I always like envied it, I guess, but like her point of view on it was a little bit different than my point of view. She kind of, she enjoyed her job, but you know, over time she kind of got a little tired of it. But I definitely am working in the field now, and I love it, and it's great. I really enjoy it, and getting to see that job firsthand, and then everything else. And
having been a patient.
Yeah, yeah.
I want to ask Dr. Gustello, what do you remember about the first time you saw Nicholas as a patient in Lawrence?
Yeah, I will never forget it. Dr. Ricke called me down to the emergency room, and he said, I have a young kid who's had some chest pain and is having some altered mental status. And I walked into the room, and Dr. Ricke had the echo probe on his chest in just the spot that I needed. And I see this kid who is blue, and I look up at his vital signs, and he have low blood pressure, and he looks very sick. And I look at the echocardiogram, and I see the biggest aorta I've ever seen, and I can see where it is tearing. And I just say, oh my goodness, he has an aortic dissection. We got to get him out of here or he's going to die.
Wow.
And that's it. And I saw our emergency room go into this mode I've never seen before. Everything just got quiet, and everyone just knew the gravity of the situation. We had to get him out of there and to KU now.
Dr. Ricke, from your perspective, what alarmed you most that made you call Dr. Gustello and sound the alarm?
Yeah, so we were really fortunate to have a great EMS crew out here in Lawrence, and they quickly realized that Nicholas was very sick. And so from the time he hit the door, we were trying to talk to him. He really wasn't responding, and kind of grumble and say, you know, my chest, my chest. So we quickly hooked him up to the monitor. When I wasn't able to get the vitals I expected, we quickly did an ultrasound. And I think if I remember correctly, I had stepped out of the room, and Dr. Gustello was actually doing a consultant on another room down the hall. And so we were very fortunate that day that she was immediately there, and things were lining up for us. And so for better or for worse, it was not a subtle ultrasound that we could quickly see that dissection. And the real true benefit of having Dr. Gustello there is to have, you know, a second set of eyes to confirm this, because the phone call with KU or Dr. Zorn is going to be to try to convince someone that myself is not an ultrasonographer, but someone who trained at KU, that this was indeed the diagnosis, that you've got to take this, you know, guy to the operating room without official imaging or those sorts of things. And so that's a hard conversation sometimes. And so very blessed to have Dr. Gustello there with me.
Dr. Zorn, when we were first talking about Nick, I'd said, wow, so you saved this guy's life. And you said, no, I didn't save it. The doctors in Lawrence saved his life, which was really wild to hear. Dr. Zorn stressing that Dr. Ricke and Gustello were the reasons Nick is still alive by having immediately flown him here. Rather than ordering more scans, how close to the edge was Nick when you saw him?
I mean, we don't often take somebody straight to the operating room. It wasn't necessarily our plan, you know. When I talked to Dr. Ricke, you know, about what was going on in Lawrence, you know, the plan was, let's not get more scans, let's just get him over as quick as we can, and we'll assess him, and we'll get what we need to here if we need to scan him. But like Dr. Gustello said, you know, he was gray when he got to us. You know, we couldn't find a pulse, and so instead of going to the ICU like we had planned, he went straight to the operating room. Straight
to the operating table. Nick, do you have any memories of any of this when you hear the doctor say you were mumbling and saying things?
I mean, like, I got, like, I don't know. The way, I think part of it is me kind of reliving the event from, like, who I've heard it from. But sometimes I do kind of, like, I don't know. It's kind of a weird dream sometimes.
Like a flash
of
a dream you're remembering.
Yeah, but it's not bad. I mean, the experience was an experience, I will say that, you know, but.
Dr. Ricke and Dr. Gustello said they immediately knew that they had to get Nick on that helicopter and get him to the health system. You've said not all doctors might make that quick decision.
Yeah, I mean, I think, you know, a lot of doctors are going to go down, you know, maybe a more confirmatory pathway and get the CT scan, but I think they correctly, you know, decided that, you know, this kid was too sick to put in the scanner to waste more time. And I can promise you that if Nick shows up 5 minutes later, he's not showing up, you know, just with a low blood pressure. He's showing up in cardiac arrest, which he was really close to as it was. And so, you know, it goes to show you how much of a team this sport is, you know, from EMS to the emergency department to our consultants that we have. You know, it's not just one person. So,
Dr. Gustello, are you at any point talking on the phone to Dr. Zorn? How does this work when you're actually communicating, or are you going through like written channels? How does that work?
So everything went through Dr. Ricke. As soon as we said, oh my goodness, he's dissecting, Dr. Ricke just went into action. He started saving the pictures from the ultrasound and started calling Dr. Zorn directly because we knew
so you talked
time was of the essence.
Okay, so Dr. Ricke then, how soon after it was made the call that Nicholas was going to here to the health system, how soon after that call was made was Nicholas actually like up in the air and on his way here?
So before I even called transfer center, we had called for a helicopter. So our local life flight is on the way as I was waiting to talk to Dr. Zorn, which I think took all of a few minutes, but it felt like a long time. But he was, from the time we made the call till the time he was in the air, was probably less than 20, 30 minutes.
How common is it for you to have in Lawrence a young patient come in with an aortic dissection?
Very rare. I would say from an aortic dissection, very rare. Fortunately, it's something that you see a handful, maybe a dozen times in your career. But on a young patient, it is extraordinarily rare. And so fortunately, we were able to get it quickly diagnosed for Nicholas to get him to the right place.
So Dr. Zorn, he arrives and he's immediately rushed into surgery. Nicholas, or Nick, you prefer to be called Nick,
yeah,
so I'm going to call you Nick. You open your eyes. Last thing you remember basically is laying down for a nap, feeling rotten in Lawrence. You open your eyes and you're recovering from open heart surgery in a different city. Who explained to you and filled in the blanks? Who were the first faces you saw?
Honestly, I'm trying to remember, but I believe it was my girlfriend, my dad, maybe one of the nurses, and then my mom. Or like I've had a great support system. I mean, everyone stepped out for me. You know, my stepbrother lives in Tennessee. He came in. My girlfriend's family up in Nebraska, they came down to see me. Like, I had an excellent support system, but I remember like the first few faces I saw were those three.
So trippy.
Yeah, and a little bit of a discussion of like, hey, like you're at the hospital, like you had this surgery, you have to, you know, like I think I was intubated at the time too, if that's correct.
So can you explain what intubated is for people who don't have a medical background?
Once, most people that come out of cardiac surgery still have a breathing tube that's supporting their respiratory function, and so that, usually we wake people up and get a good neurologic exam to make sure that they're able to protect their airway before we remove the breathing tube, and so that's probably what kind of he was experiencing.
Let's talk a little bit more about aortic dissections. And again, Dr. Zorn, how would you explain an aortic dissection to someone who's never heard of that before?
Yeah, so the aorta is the conduit to, where all blood goes through to get to the rest of the body's major organs. And so in some people, either there's a genetic cause or just because of conditions that they've developed over their lifetime, mainly high blood pressure or maybe smoking status, it's a different pulp, but the aorta starts to enlarge. And when the aorta enlarges, it can weaken in areas. And we know, the dissection is where we get a tear. The aorta is made up of 3 layers. We get a tear in the innermost layer of the aorta that allows blood to track through the aorta. The
image on the right-hand side, where it's kind of peeled away and filling. How do you repair that? How did you repair it for Nicholas?
So there's different ways to repair it, and there's the operation can be anywhere from just replacing a small section of the aorta from where you see those 3 blood vessels that are going off to the head up top to just before the valve that leads into the heart on the bottom, or you have to replace all of that from where the valve enters the heart and all the way up past where the head vessels go. And so in him, we call that bottommost portion where the valve, where the aortic valve is, and where also blood vessels go off to the heart. We call that the root of the aorta. We had to replace that in him.
What do you use to replace it?
It's a conduit. It's a graft that has a implanted aortic valve in place.
What's it made out of?
It's made of a Dacron type material.
Okay.
So.
And then when we look at the stages of an aortic dissection, as you can see here, does this happen quickly, or can this be an event that just slowly builds over weeks or months?
I think it's very variable. I think in some people it happens probably in a matter of seconds and minutes, and those people are probably that progressed in a very aggressive fashion to, frank rupture that you see on the right, and those people are probably ones that don't make it to the hospital. In some people, it progresses and then it stops. Gives us time to react to the diagnosis. And some people, you know, but most of those people we know will continue to progress over time. And then some people actually, they come in with just a chronic dissection that happened a long time in the past, and that's much more rare that we see that, but we do see that from time to time.
And what do you think Nicholas was? Was he a quick one or a slow one?
I think he was a pretty quick, quick evolving aortic dissection, which is not stopping. Was, you know, he never really stabilized from his initial dissection.
So every minute counted. As you said, 5 minutes later, and we might not be sitting here, which kind of gives me a funny feeling. What's it like for you to sit here talking about your journey that you barely remember?
It's a little weird, I won't lie, but I mean, I don't know, it's kind of cool. I don't know, I gotta admit, like, it is a very interesting thing that happened to me.
It has a happy ending too.
Yeah, and it ends well. You know, otherwise this would have been a tragedy, and everyone would have been, you know, upset about it and horrible. But I mean, I was fortunate and incredibly lucky, and like I said in the video, I had like some of the best medical care I could have had at that time, at that moment, every single step of the way. I was incredibly lucky. Everyone there was incredibly skilled. Everyone knew what they were doing and how to do it, and now I'm here today because of it.
After all of this, then you were diagnosed with a genetic disorder called Marfan syndrome.
Yeah.
That must have caused you to look back on your family history. Did you discover anything looking at your family tree?
Not really much. I mean, my dad, it seems like he's a likely candidate because he has a pretty mild case of it from it looks like.
Now, you don't exhibit any of the outward physical traits,
No.
The longer limbs of Marfan syndrome. So, Dr. Zorn, how common is it for you to see a patient and see that they don't have those outward symptoms?
I would say we can tell most of the time when somebody comes in with Marfan syndrome. And I think we expected it. You know, he doesn't have all of the typical features, but he's a long, lanky guy, and he's, you know, in his 20s when he shows up, and, you know, that's got to clue you into some genetic cause.
More like long and lankier than most guys in their 20s? Because I imagine like a lot of young guys are long and lanky, but you just saw something that...
I mean, mostly it's like what Dr. Ricke was saying.
Yeah.
This is a rare thing to see in young kids. So there's got to be something that's driving it. And so there's not a lot of genetic conditions out there that are causing these aortopathies. And probably Marfan's is, you know, the most common in somebody his age group. So.
And did you encourage the genetic testing?
I think we had to encourage. She had a great cardiologist in St. Louis, right, that, that was on it from day one, and we were talking even before he left the hospital. So I think the plans were in the works to get him tested.
You did, when our team first interviewed you, you said you did since discover you might have a physical trait in your sternum.
Yeah, I have a bit of a chest divot, which is a bit unique. I mean, I know
the bones kind of go in there.
Yeah, they like protrude inwards. Yeah.
But not something that you would have ever paid attention to.
I mean, not really. Like I've noticed like, oh, like this isn't normal, but like I have a friend who has like the inverse of that, where it points out a little bit more. You know, like it's not something you think about as like, oh, this is a genetic disorder.
A rare genetic disorder.
Yeah,
right. It's not where your mind would go. No. We do have some questions and some comments coming in. So if you have anything that you'd like us to ask out loud on the program or share, just send it to us on YouTube, Facebook, or the All Things Heart email. You'll find the links on how you can connect with us in real time right there on your screen. Nicholas, we tagged along with you as you underwent a CT scan. This was about 3 months after your aortic dissection. What does your recovery process look like now as far as doctor's visits and tests and scans?
I mean, primarily just doing like CT scans once a year now at this point. You know, obviously initially it was, you know, every 3 months, 6 months, and then now I'm at a stage where it's going to be a year from each visit. Maintaining like a pretty like heart healthy diet. I do pretty mild like exercises, just like a little bit of like running, just kind of keep myself like physically fit, I guess.
And then what do you look for, Dr. Zorn, when you see him for those tests?
Well, I mean, Marfan syndrome affects the aorta, and we know it doesn't just affect the aorta where we replaced it, but it affects it throughout its entire course. And so also in patients that have had dissections, they usually have a residual dissection flap. So we're looking for, you know, is the aorta enlarging overall? Is the lumen that most of the blood going through or supposed to go through, is that staying the same size? They would call it true lumen and a false lumen. Are those changing in any ways? Are the the blood vessels that come off the aorta, those still look the same as they did in the prior scan, or are those evolving in some way? And so we just have to keep an eye on it, because things can still progress at this point.
Sure. And Dr. Ricke and Dr. Gustello, you practice medicine in a college town. A lot of teenagers and 20-somethings think they're invincible rather, not invisible. Everyone's watching them. But they push through everything. How common is it for you as doctors to see students who didn't realize how sick they were or ignored the signs? Dr. Ricke, I'll start with you.
Yeah, fortunately, most 20-something-year-olds are as healthy as they think, which is great. But we're just trying to take every patient seriously in a college town like this, because you never know. And so it's really looking out for those red flag symptoms. Fortunately, Nicholas's presentation for us was not subtle, and we see those, on a somewhat routine basis, where patients, maybe had put something off or really see a red flag symptom, and you chase it down until you figure out what's going on.
Dr. Gustello, what about you?
I think Dr. Ricke said it perfectly. Most of the time, the patients that are young that we see are really healthy. But if you don't feel well, if you think something is wrong, go to your doctor, check it out. We're here to help.
Dr. Zorn, Nicholas thought he had heartburn. Nicholas, you thought you had heartburn, or you just been, let's face it, you're a senior in college, you're at the end, going out with your friends, no one's feeling physically at their peak at that time. How long had you been feeling bad?
I think my girlfriend, we had a date party that Saturday, and I felt some chest pain. We'd been drinking that night, obviously. And I was like, okay, just take Tums. I'll feel better in the morning. Didn't feel better in the morning. Right. Didn't improve. And I was like, all right, something's clearly not right, but I had to focus on school. That's my _1 priority.
And you said you thought you had the flu or something because you'd gotten sick during one of your exams.
Yeah, I kind of thought I was anxiety. Initially.
Sure.
I'd been moderately sick, but nothing the vomiting incident was literally probably an hour before I went home, and then
took the nap.
Yeah, I took the nap.
Led you here.
Yeah.
Dr. Zorn, how would someone watching know then the difference between feeling like they might be sick or have anxiety and having this potentially deadly event?
I think the good thing is heartburn is mostly heartburn, and this question may be a better question for Dr. Ricke, because they see this all the time, come into the emergency department, but
sure.
We do, when somebody comes in with, heartburn, that's a little, they see us because heartburn's a little bit, it's not going away, as Nick said, or it's different than, something, other heartburn symptoms that I've had prior, then that has to lead us to work up other causes, and there's many other causes for, what patients come in and describe as heartburn, and some of them very serious.
Luckily, heartburn's the most common cause, though. Not
heartburn
aortic dissections.
is probably the most common cause of heartburn symptoms.
We have, thank you for that. Thank you, Dr. Zorn. Okay, we've got some comments and some questions coming in that I want to read out. First of all, Alice writes, so happy for him, great team, great save. And then another question for Alice, she writes, or perhaps this is a comment. She says, my husband had a heart attack 3 weeks ago. He didn't know it. He passed it off as heartburn as well, ran a half marathon 2 weeks later, holy smokes, and he somehow had time to get to vascular and have a stent put into his RCV. I will suggest him to ask his cardiologist about this syndrome because his heartbeat is slower. Okay, so should Alice ask her husband to ask the doctor about Marfan syndrome? Should everyone who's had a heart attack do that?
I don't think so. There's a lot that goes into it. I think certainly seeing his cardiologist and talk about, their concerns is probably warranted. But, there could, so I don't think Marfan's maybe first on the list of things to think about, but right. Certainly other, things could be depending on his age. And
I wish Alice would clarify that her husband had a heart attack 3 weeks ago, didn't know it, and then ran a half marathon.
Yeah.
If you're still watching, Alice, did he get diagnosed and recover and then run a half marathon, or is it possible to run a half marathon?
Or what was his time?
While you're having a heart attack?
Yeah,
that's wild.
I think it's the biggest indicator.
A machine.
Yes.
That sounds wild. Okay, Jeremy writes, now that it's happened and his aorta was worked on, does that mean Nick's aorta is basically shored up and protected against future dissections? Or does the Marfan syndrome make it a risk you have to keep monitoring?
For the rest of the aorta that's not replaced, there still can be further dissection or evolution of other aortic syndromes, but that place that we replaced, which is the problem area that can lead to most catastrophic consequences, is fixed and won't cause them problems.
Viewer Marie has a comment for Drs. Ricke and Dr. Gustello. Marie writes, I can't tell you how reassuring it is to see how brilliant the doctors are in Lawrence. My kid goes to KU.
Oh, good.
Thanks.
I mean, thank you for that.
Yeah.
He's here because of your quick action and the teamwork with Dr. Zorn.
Amazing.
Lauren wants to know.
That's what we're here for.
And we're so glad.
That's what we're here for.
So lucky to have you. Lauren wants to know, how do you get tested for Marfan syndrome? What was the test like?
I mean, it's pretty simple. It's like a saliva test. I mean.
A what test?
A saliva test.
Okay.
Like I said, the spit in a cup, basically, and ship it out to FedEx. I think for me, they were kind of specific. I'm looking for like 4 sets of genes and then narrowing it down to like which one of that is. I had a pretty good specialist too back in St. Louis. He's made a whole career out of it from what I understand of it, and he was able to kind of walk me through like, hey, this is how this is going to work. It won't be too difficult, and then from there we'll kind of explore your family tree, and then that's where we found out that my dad also has the disorder.
Right.
As well.
What was we do have a question, people wondering what the reaction was from your whole family.
Shock, surprise. I mean,
right.
Like just a few weeks ago I was great, back to graduate, looking at finding a job somewhere, trying to figure out if I want to go to St. Louis, Kansas City. My girlfriend's from Nebraska, so maybe going up there and spending time with her and her family. And then, this happens and everyone's
right.
like scratching their heads of like, A, how does this happen? And B, like, is he okay? Then how did this happen? Yeah.
It's stunning.
But
there's the expression, man plans, God laughs.
yeah.
It throws you the greatest curveball of all time, but you're here and you look amazing.
Thank you.
This is such a great discussion. As we wrap this up, I'd love to get today's takeaways from all of our guests. And Nicholas, I'll start with you. How do you feel about sharing your journey with the public, and what do you want people to know?
I mean, I'm pretty comfortable talking about it. I mean, it's an experience, like I said, it's cool, I guess. Not in like a good way, but it's a very interesting medical
medical journey. Have you been able to meet Dr. Ricke and Dr. Gustello in person since you came into the ER?
I haven't, unfortunately, which, I mean,
well,
like I said, real lifesavers. Yeah.
Hopefully
which
you
I
meet
appreciate
them
everything you guys have done. Yeah. So thank you guys.
Hopefully you don't meet them again in the ER.
That's the goal. Yeah.
Dr. Ricke.
Or maybe as a nurse.
Hey, maybe.
As a nurse. Dr. Ricke, what would you like our viewers to know?
I appreciate to be able to be here to see Nicholas alive. Most of our patients, after their discharge, they go home or admitted. I don't get to see that. And so it's really great to see good outcomes. It's good to be practicing in an environment where there is good continuity to be able to ship patients to KU or elsewhere where they can get some of that more specialized care that they may need. And Nicholas, you're welcome back anytime to visit.
I'll keep that in mind.
And Dr. Gustello?
I just think this is such a great case. You have a young college student who was otherwise healthy and came in really sick. And it just shows the great team sport, as Dr. Zorn said, that it took to get him taken care of. And it's just so wonderful to see you alive, Nick. So great to meet you in person.
Dr. Zorn, we do have one more question from June. June wants to know, how many aortic dissection patients do you operate on every month, and how long is the surgery?
We probably see, we don't see a ton here. Dr. Crawford has all that data, but it's probably around 25
a month
to 30 a year.
A year, okay. Yeah. And how long is the surgery?
As a whole, as a group. So the surgery can be probably anywhere from 3 hours to 6 hours.
Okay. And how long did it take you to recover and be up and at 'em?
A couple days out of the ICU, I remember like walking around on the heart floor that I was on. So, I mean, after that, I was like recovering, obviously, because my sternum was broken and I was in a lot of pain.
But you always make your patients
quicker than the average 65-year-old guy.
Yeah.
Right. Well, that's good. Yeah. And you make them do laps after every one of your surgeries.
Day one, as long as they can. So.
And what would be your final message to our guests?
I don't know. There are saves and then there are stories like Nick's. This is one that we all like to file away, and because these are really drivers for us to keep going and keep practicing what we're doing. They're uplifting, and so it's nice because I still get to see Nick walking in the hallways in the hospital now. So it's always a good reminder, and like I said, just evidence of a team that that really works. And so credit to everybody that took part in this care. And so.
Well, thank you for being here, and thanks for sharing your journey. And Dr. Ricke and Dr. Gustello, thank you so much for your incredible work and being a huge part of why Nick is here to share his story. We really appreciate our viewers for joining the conversation as well. Thank you for watching the program this morning. Coming up tomorrow on the Morning Medical Update, a chance conversation at a small-town brewery turns into a life-changing decision. One man donates a kidney to a stranger and then sparks a movement that saves multiple lives. Tomorrow at 8 a.m.